Hey friends, you have been asking for a day in the life of a fertility doctor for a long time because I know what I do is a little bit different. And doing my job in the middle of a natural disaster is something extra. So I wanted to share that with you today. As a fertility doctor, my job requires a few different things. I see new patients, which right now, because of COVID, nothing to do with the snowstorm, all of those visits are virtual. I also help take care of patients in treatment cycles or undergoing diagnostic tests. So a large part of my job is procedural, which is great, and my days really vary. The snowstorm has added a whole extra layer of complexity because IVF doesn't shut down, or it doesn't normally shut down. To be honest, there's a clinic here in town who canceled all their cases. There's a clinic in Houston who didn't have power, which should never happen to an IVF lab. And so it is a really hard time to be a patient undergoing fertility treatment. And what about getting medications? That's a whole nother issue. So patients are in IVF cycle and they are not getting deliveries of medications. They're running out of medications. And yes, it is IVF, but fertility care for somebody who's been dreaming and working for a family is expensive and time sensitive. Those of us in the field do everything we can to be there and to not have these cycles get canceled unless it is totally unavoidable. And at Fora, my practice, it is myself and my partner, Amanda Skillern. We have worked our butts off to make sure fertility is still ongoing. Skeleton crews, one of us going there every day, making sure that fertility continues. Your fertility clinic needs a plan for a natural disaster, and that's a great question to ask. Are there generators? What is the emergency plan? Where are you going to send me? Where are you going to find people? What's going to happen if one of these terrible things happens? I decided to take you along on a little bit of my day. So you're going to see what happens on a day in the snow and what I'm doing on procedures. And I'll have some video, some pictures, and we'll just talk about it. Typically, this channel is all about fertility education, so subscribe if you want to get more of that information. So going on the snow day, it was myself, one of my nurses, and we had one medical assistant. So there were just three of us that are going to be there, and we had patients who were in cycle. So anybody who had a non-time sensitive procedure, we moved them to a different day. The drive-in was rough. I actually got stuck in the snow as an REI fellow. So we lived in North Carolina. I was 6 months pregnant and I got stranded on the side of the road. This was the 2014 huge snowstorm that really devastated the South, but more the Southeast, like Atlanta. And I was driving home from clinic. I had patients all day and the snow just came. It was all out of the blue and there was cars getting stuck on the side of the road everywhere. I had a little car and I lost control of my car. And you can see there are just cars everywhere. Everybody was pulled off and stuck. And I was totally unprepared for the snow. And I'm a Southern girl, not like a snowstorm type of person. So I had on leggings and boots and like a wool coat, nothing appropriate. And I got out of my car. There was people all over the road, terrible traffic. And I decided to walk to Whole Foods. So it was about a mile away. And I thought, if I can get to Whole Foods, I have everything I need. Water, food, bathrooms, I will be set if I can get to Whole Foods. I mean, that plane was so dumb. It was so cold. I probably would have fallen and hurt myself. But I get out and start walking, and a Good Samaritan in a truck, a stranger, rolled in the window and said, "Hey, pregnant lady, what are you doing?" But essentially he had his daughters in the car. His wife was a nurse. And he said, "Hey, I'll drive you to the Whole Foods if that is your plan." And so I got up in the car with him and we picked up his wife and he actually drove me all the way to my house and not just to Whole Foods. So I know how serious the snow is. I left extra early to give myself plenty of time and I made it. And actually the way there was pretty fine. When I got there, I just was crazy how much snow was all over the place. So I made it in. Roads aren't easy. Fertility waits for nobody. If you pick this job, just know you're coming in. I've got egg retrievals, embryo transfers, IUIs, ultrasounds. Here we go. And I thought since clinic was empty, since we really cut down, I could give you a tour of our new office. Nobody's here yet, but let me give you the tour of the office. Okay, this is our cute little office. You can see me reflecting in the snow in the windshield. And we opened in July, so nobody really sits in this waiting room. This is our front desk area. Here's Olivia. Here's Lexi. And then we have ultrasound rooms for monitoring. So patients who are in cycle come in for ultrasound monitoring daily. And then we have a blood draw room back here. So patients get estrogen, blood draws, bathroom, break room storage. So you can see our nice Fora blue everywhere. And then here is my office right here. Now you see all of these rooms. Our office is specifically designed. We don't have patient consultations. So if I'm gonna have a consult with you, we're actually gonna sit right here. Like this is the view my patients see also. And we'll have a virtual visit. My general schedule is Mondays I don't work. And everybody knows it, so don't bother me on Monday. I do this stuff usually. Record the podcast, do YouTube, write content, do the blog. Then on Tuesdays and Fridays, I cover IVF. So my whole morning is IVF procedures. So I'm the treating doctor for anybody in cycle. So I do ultrasounds, diagnostic tests, inseminations, egg retrievals, embryo transfers. And then in the afternoon, I usually see some virtual patients. So I come back home. Wednesdays and Thursdays, I work from home. And then I'm on call every other weekend. But we really are very smart about not going into the office unnecessarily. We definitely work on weekends. So if you're in medical school and you choose REI, you're going to be on call on the weekends and holidays and sometimes when other people aren't. But our call is not tedious. So I'm not going in for emergencies in the middle of the night. I'm mostly answering patient questions and then doing procedures if they tend to fall on the weekend or somebody has to be seen for an ultrasound. If it has to be done, it has to be done. In the snow, on a Sunday, doesn't matter. So that's one thing about this job that's important to know. It is time sensitive. But in the office, you could see those ultrasound rooms. These ultrasound rooms are where the bulk of our morning appointments come. You'll come into the ultrasound room and we call this monitoring. So these are monitoring appointments to see how somebody's doing in a treatment cycle. These appointments are determining if the medications are working, helping us with the timeline. They're usually very fast 10 or 15 minute visits where you're seeing a doctor, vaginal ultrasound, and what we're looking at is your ovaries. So pictures of your ovaries in the middle of monitoring, you can see what a normal ovary looks like. It's the small little black follicles, and then you can see IVF. And so an IVF ovary is huge. This is called controlled ovarian hyperstimulation. We're trying to get all those eggs that are outside the vault to grow. And I have a whole video on IVF if you've never seen it or heard about IVF and you want to learn more. But IVF is the most expensive and time-consuming thing that we do. We want to know when are those eggs going to be mature, and every person matures them at a different rate. So we need to measure them, and that's what we're doing on monitoring. Then I had egg retrievals and embryo transfers. Egg retrievals is the act of taking the eggs out of the body. It's done under anesthesia. So we had anesthesia come, patients get an IV, a needle is attached to a vaginal ultrasound, and the ovaries are entered from the vagina, so no incisions on the abdomen, and we drain out those follicles and we get test tubes full of fluid. Those can either be frozen as eggs, so I have some patients in cycle who are freezing their eggs, or they can be fertilized with sperm. That's IVF or in vitro in the lab fertilization. And so that's super time sensitive. When the eggs are mature, you use a trigger shot and then the time is set. If something happens and your retrieval can't happen at that time, it's not gonna happen. That's the most time sensitive thing that we do. Here's a little clip of an egg retrieval from a patient who totally consented to it, just so you can kind of see what it is like as we are entering. I'm watching the ultrasound along the way so I can see the needle enter into the follicle and then it collapses as it's being drained. And then an embryologist looks through and identifies the eggs. And the eggs look very fluffy under the microscope. They're surrounded by cumulus cells that keep them protected. And then those cells are stripped off and the egg is determined to be mature or not. And then fertilization occurs. Embryo transfers are actually pretty easy in experienced hands. It's my favorite procedure I do. Patients are wide awake. You get to talk to them through the whole procedure. I really view this as my moment to be a calm, soothing voice. I don't think this part of the process should be any more stressful than it has to be. So we watch with an abdominal ultrasound. So we go abdominally. Your bladder has to be really full because it helps improve the sound waves. And then we see the lining of the uterus. And a tiny catheter is placed through the cervix into the uterus and the embryo is injected while you watch with ultrasound. It's painless, it's very quick, and it's very high stakes. Our lab right now is not in our own building. We will be having our own building and lab eventually, but at the current moment, we have a lab that is a few blocks away. So Lexi was my procedure nurse today, and we hiked down to the office because it was snowing and I didn't really even trust the car to get there. So we went from the office to the lab, we put our snow boots on, started going. I was slipping all over the place because it was so icy. Lexi caught me like 3 times. And then one of our patients who was leaving monitoring drove by and they were in a big old truck and she was like, "Hey girls, do you need a ride?" So we said yes. So they actually drove us and dropped us off on our way to procedures and then we hiked it back. After procedures, saw a few more patients who just couldn't make it in the morning. I did 1 IUI, which is an intrauterine insemination. So this is when the sperm is cleaned and processed, put into a small syringe, and then put into a flexible little catheter. Just like in the embryo transfer, that catheter is inserted through the cervix into the uterus and the sperm is injected. The difference is in an embryo transfer, I have an embryo, an already fertilized egg that's an implantation stage embryo ready to go. And in an IUI, I just have sperm. It still has to do all the work. I always refer to this as getting your best players further down the field. They still have to make the shot. They still have to swim, fertilize the egg. Embryo has to go through the fallopian tubes, enter into the uterus and implant. So there's still a lot of body parts that have to function in order to make that pregnancy happen. Then after that, I drove it on home and didn't have any virtual consults because we moved them all. People were in and out of power. I've done other virtual consults this week. It's just been kind of crazy. But at home, we dealt with our own issues. I had no power for 2 days. The water pressure's been really low. We're under a boil notice now. And it's been kind of crazy. So we're very fortunate to have heat and power now. We still have gas. So not all of Austin is like this. Not just in fertility, but our hospitals are having major loss of supply issues. Hospitals have been closing because pipes have burst. They've run out of water. They don't have any oxygen. They can't do dialysis. Their ORs are flooded. This is a major crisis on a healthcare level. So not only is it people can't get medications, people can't get dialysis, diabetics can't get insulin, fertility care is being interrupted, people can't get to the hospital to have their baby. There's huge issues happening right now. There's also families that are having carbon monoxide poisoning, fires and freezing and starving and very serious issues. I know how lucky that we are. I'm glad I could take you guys along on this day with me because it's something not a lot of people see. They think our job as a fertility doctor is very glamorous and easy. And I've worked hard to make my job have the lifestyle that I want. The schedule that you see, she and I feel very strongly that we have young kids and we want to be present for them. So another note is you can make your life how you want it. You just have to work for it. So we know where we draw our boundaries and we want to be home just as much as we're in the office. I'm going to leave you with a couple videos and pictures of the kids playing in the snow. I hope you enjoy them. Feel free to subscribe if you want more fertility information. I have great stuff coming to you. And as always, you can listen to the As a